any imaging that uses ionizing radiation entails a risk and a benefit to the patient. The benefit is diagnostic information, but the risk is the exposure to the ionizing radiation. The structures that are most sensitive to radiation, and we call it radiosensitive, vary with age. So children who have a lot of active marrow in their bones are more sensitive in some ways than adults. The lens of the eye is very sensitive to ionizing radiation, and too much ionizing radiation will cause a cataract. The brain is relatively insensitive to ionizing radiation. The thyroid gland in the neck is very sensitive, and too much ionizing radiation is a known risk factor for thyroid cancer. Usually we're talking about exposure from nuclear plant disasters or treatment level doses of ionizing radiation more than we're talking about diagnostic level doses, the amount a patient is exposed to for a chest x-ray or a CT scan, but it's always important to keep the risk of ionizing radiation in mind. We strive to minimize the exposure to ionizing diagnostic radiation, both for the patient, for the technologist, and for the radiologist. The patient can be screened. So for example, if we're doing a CT of the brain, we can give the patient a lead shield to cover the thyroid gland. If we're doing an x-ray of the chest in a child, we can screen the pelvis and abdomen as necessary. The technologists and the radiologists wear radiation badges that record our exposure to ionizing radiation. We are allowed to have higher levels of exposure than the general population. The general population is protected to some extent because all of the rooms where these procedures using ionizing radiation are screened. So the CT scanner room is screened, and the rooms where radiographs are obtained are screened to protect the public from exposure. The radiologist who reads the study at a computer terminal remote from the exposure isn't at risk beyond the radiation from the computer terminal itself. But some of the procedures we do entail the radiologist and maybe a technologist and a nurse being in the room with the patient. And in those instances, we actually wear lead gowns, vests, skirts, aprons, thyroid shields, leaded glass over our eyes to minimize our exposure to the radiation.